go back to the story in men because, as I said earlier, that's where we have, I think, a little less recognition and understanding in the general community. And what we see for men is that there are two cancers that are particularly concerning among men that are caused by HPV. And I say that because one of them, which is anal cancer, is increasing significantly among men as well as women in the United States and in other high-resource countries. Now, anal cancer, and what's particularly concerning about anal cancer is the incidence of this cancer is very high among men who have sex with men, as well as individuals who are HIV positive. And in fact, the incidence of anal cancer caused by HPV, 90% caused by HPV, is around 80 per 100,000. So that's approaching the incidence rates that we consider for common cancers like prostate cancer among men and breast cancer among women. Now, the second cancer for which we're seriously concerned is oropharyngeal cancer. Now, these are cancers of the base of tongue and the palatine tonsils. And in the United States, we've been able to show a growing incidence of this cancer, which tends to be in contrast to what we see for other head and neck cancers, where the incidence has been going down as we control tobacco use. The incidence of the HPV-related oropharyngeal cancer is significantly increasing in the United States and other high-resource countries among men specifically. And among men, the rate is 3 to 4-fold higher than among women. And not only is the incidence rate going up for this cancer, but the proportion of the cancers that are due to HPV infection, again, mainly HPV 16 and 18, that proportion is also increasing. Today, we approximate that 75% of all oropharyngeal cancer tumors in men are due to HPV infection. Now, a third concern. These are cancers for which we have no screening protocols. So unlike cervical cancer, where we at least have something we can offer to prevent the incidence of the cancer, we do not have reliable screening methods to detect a precancerous lesion, treat it, and then prevent the cancers. So there is no screening available for the cancers that HPV causes in men.